Next, I'd like to invite Tex Kissoon to speak about the global perspective of sepsis. He had shut down the intro the last time around, so I think I'll finish it off. So Professor Tex Kissoon is the UBC Children's Hospital Endowed Chair in Acute and Critical Care Global Health. He was past president of the World Federation of Pediatric Critical Intensive Care Societies and is the current president of the Global Sepsis Alliance and co-chair of Pediatric Surviving Sepsis Campaign, as well as vice president of the Canadian Sepsis Foundation. He's on several advisory boards and that work in the USA and Africa, and he's chair of World Sepsis Day. Today is World Sepsis Day. He's been instrumental in lobbying the World Health Assembly of the UN to adopt a resolution on sepsis, which passed in May of 2017 at the World Health Assembly. Thanks, Tex.
Okay, thanks very much. And I know this is late in the day, and I think most of you have heard enough. So I will try to be as brief as possible. Basically, I was asked to address a global perspective on sepsis, but I thought I'll broaden it to see where we fit into it and what we can do. So it will be a quick rundown on this. And if it makes everyone feel a little better, earlier today I was speaking to the head of the African Union and the African CDC, and they are grappling with the same issues that we are. And it made me realize we came out of Africa, but we're not that far evolved. So I think it's really a global problem. And as Paul Farmer said years ago, that borders are like semi-permeable membranes for infections and sepsis, but money, humanity, drugs, everything stops at borders, and it cannot work in a world in which we live in, as we've seen with SARS, and we've seen with Ebola, and we've seen with COVID and influenza. And in fact, that should give us pause, because in Canada, 30% of Canadians were born somewhere else in the world. Half of those were born in tropical countries, and with air travel back and forth, there are many tropical diseases out here now. We're seeing, again, re-emergent diseases in the US. We've had malaria and dengue in Florida. We've had chikungunya fever in Texas, and we have dengue in the Caribbean, which we haven't seen years ago. So it's really a global problem that we're dealing with. So you heard about this, the 11 million deaths, etc. But the vision that we have for World Sepsis Day and the GSA is 0 preventable deaths from sepsis. And I think we all have that very same sort of goal, and how we go about achieving it is really what is the difficult thing that should give us magic. So these are the 4 areas I will cover very quickly. Now, the global perspective, in fact, I looked at more than 60 or 70% of the posters out there reference this article. I would not spend long on it. About 50 million cases, 11 million deaths, 20% of global deaths, #1 cause of death in the world. And you've heard also of the issue of 1/3 die within a year, 1/6 experience the morbidities, functional limitations, and 40% are rehospitalized within 90 days. And in Africa, where we're working, the same number of kids that die in hospital, if you follow them for 6 weeks to 6 months, the same number die out there. And we're trying to change that. Now, this I put this false dichotomy, and the reason I put this here is that there are many public health experts or policy experts in the world that says we should not be dealing with infectious disease, it's non-communicable disease, diabetes, obesity, hypertension, cardiovascular disease, cancer, etc. A friend of mine who was head of the public health agency in Canada, in the Caribbean, CARPHA, Caribbean Public Health Agency, he chased me out of his office when I told him about sepsis. 5 years later, I was getting frantic call at home. He got sepsis, leptospirosis, sepsis, ended up in Long Island Jewish Hospital, where we started the Sepsis Alliance, and now he's a convert. So the message here is, it is not either or. 50% had non-communicable diseases, so we have to deal with both. And when policymakers come to you, that should be the message. Children younger than 5 years of age, almost half the number of cases, and almost 3 million deaths. And the other thing is low and middle income countries bear the highest burden, 85% of cases and 85% of deaths. And there's an inverse relationship between wealth sociodemographic indices and sepsis. And there are graphs within this document. The importance of this document took me about 5 years to convince the Global Burden of Disease, the IHME, that sepsis is an entity. And we got this. There's another review follow-up to this coming out, which shows the number of deaths is 13 million. It's higher than before. And at the same time, if you add the 6 million deaths from COVID, you know where you're going with this. When we look at populations, I think this is important. This is the US population, similar to Canada, a lot of older folks and those things, smaller number of children, and the rest of the world and where the deaths are happening, sub-Saharan Africa and Asia, this is the population. In fact, many of these countries, more than half the population is less than 15 years of age. And hence, that's the reason for concentrating on pediatric sepsis in those areas. It's all children. Very, very few people live to sort of over 65 or even 50, 55 in those countries. Demographic matters again. Someone mentioned early on we need to look at the sustainable developmental goals because many of these play into sepsis. And while good health and well-being is a center here, we have gender equity is a problem that plays into sepsis. In fact, women empowerment in Bangladesh, which is the poorest countries in the world, they were able to achieve the SDGs and it's on the way because the women were empowered to do different things. So gender equality, education, I'll show you something on education, hunger, avoiding hunger, no poverty, etc., clean water. You come down here, resilient healthcare systems, access to care, AMR, they all play into sepsis. And I know of no other medical condition that so many things, so many other diseases play into. So I just summarized a few that I did for an article a while ago that I mentioned just now, that the sustainable development goal that is important to reduce neonatal and child mortality, but it is also relevant for adults. And in fact, there is a study that came out of, it is in a Lancet, just a year ago, that showed that if a mother has achieved high school education, completed high school, her chance of her children dying from sepsis or dying in general is 31% less, and a father is 17% less. And some of my colleagues have said formal education is a social vaccine. So we have to think broadly when we think about sepsis. Now, when we think about a global agenda for sepsis, we started this 12 years ago. We started in New York, and there were a few societies that helped us. I was president of the World Federation of Pediatrics. There's the Adult Federation, the Federation of Nurses, ISF, International Sepsis Forum, and Sepsis Alliance. And you can see the press we got at the time and the headlines in many places. And since that, we've grown. This is World Sepsis Day. You don't see it up there. Oh, yeah, it's there. 2022. And it's every year it gets bigger. I have the posters for the years, and the space just keeps filling in. Now, that was one aspect of one thing we wanted to do. We also wanted to get the resolution. And the resolution we got recognizing health as a global health priority. And again, what we were very important, the global sepsis science is that as Henry Farber, who was Sidney Farber, who was a pediatrician at Boston Children years ago, saw too many kids die from cancer. And he came out and he said that a disease is like a political campaign. You need icons, mascots, celebrities, you need all those sort of things like a political campaign. You got to fight the disease in the corridors of authority and power, Congress, etc., to get the money to fight it at the bedside. And I think that's the same approach that cancer took. And then we need to take in sepsis also. these were the major aspects of the resolution. It was all dealing with infection prevention and control. And you can read that, it's on the website, it's all over the place. The point is that a resolution only gets you so much. It's about 25% of the work is done, and then you have to get this into national action plans. The other thing that we're discussing today is a resolution has a shelf life of only so many years. So we have to do something about this now. And what we are doing is today I was supposed to be in Berlin. I chose to come here. I'm happier to be home than and getting back home than Berlin. But we are having a Berlin Declaration on sepsis again. And what we are doing is the Berlin Declaration, you can go on the GSA website and sign on. We have thousands of people sign on already in support of it. And what we are doing is really trying to enforce the World Health Assembly resolution, but also at the same time, we are going to refresh the resolution, re-emphasize things, and go to the World Health Assembly again. And that would be our work for next year. At the same time, we are in about 2 weeks, we are having a major side event, high-level side event at the United Nations General Assembly in New York. And we have very much support from Unite. We have Global Sepsis, Volkov Foundation in Germany, but Clinton Health Access Initiative, and GARDP. So we are getting a lot of support, and this again is going to bring leaders. We've also worked with the G20 and G7, and they are now paying attention to us in sepsis. So that would be a global agenda that we are putting together, because that would force nations to get down and get the national action plans, which governments will then do to put money forward. Now, different countries, and there are many countries you heard mentioned today. I will just highlight a few I was involved in. And this came out of the COVID pandemic, a conference report, an expert panel out of Europe. And what they said that we should not lose all the experience, learnings, and all that we did from COVID. And they talk about digital transformation, expanded ICU, agile trials, effective registries. We know all that already, focusing on staff, etc. So with that, Switzerland took that, and I helped write a forward to their proposal, and they went along and they got $11.5 million US dollars for a national sepsis initiative that has just started in Switzerland. Similar in Sweden, they took a more narrow view. They were looking at care in the hospital only with sepsis alerts, interventions, economic analysis, process improvement, and national healthcare process. And they got, as you can see here, 90 million pounds, or I think it's euros, to start their process. Australia has gotten money, UK has gotten money, and I'll show you in the US. And I think that when we have a neighbor next door in the US, the Sepsis Alliance, and we can take out of their page and see how we run the Canadian Sepsis Foundation, because as we've all been saying, there's a lot to do. And what they did, they have a very simple mission statement: save lives and reduce suffering and improve sepsis care and awareness. And a vision is a world in which no one is harmed by sepsis. Lofty goals, but look at what they've done. They've made it a public health crisis, putting down the number of millions of Americans have died from sepsis. So they elevated it very quickly. They say anyone can be a victim of sepsis, and every one of those individuals were contacted by them, and some have become ambassadors, etc. And what they do is that every time someone on TV, news, whatever, they got with sepsis, they tend to contact the individual and try and get them working with them. So anyone can be a victim. And they said, why are so many people harmed? Well, there are a few things. The public does not know what sepsis is. Healthcare providers are not ready to treat. Government regulation has not appropriated funds, and those things align with the burden. Innovation is not moving quickly. And this encompasses everything that we're saying here. So they had a strategy, 4 pillars. I will spend just a minute and a half or two on public awareness as the most important one, what we have to do. They did this making sepsis smart, and they went from public being aware from 19% to 66%. They have millions of visits to their website. They've translated into Spanish and Chinese, etc., a lot of flyers, etc. Sepsis September month, but they have a pediatric sepsis week in April, a maternal sepsis in May, February survivor. So they always keep sepsis in the eyes of the public in the United States with these sort of things. And we cannot rely on Sepsis Day only, or World Sepsis Day. Every day should be a sepsis day. They come with a national slogan again. We heard about time, temperature, infection, mental decline, and extremely ill. That is their slogan. They won several awards for it. It's on radio, TV, home, or whatever, similar to the Stroke Fast campaign. So they have made it simple. They have made it bite-sized so individuals can absorb it and follow it. They have superhero challenge where they run, walk, swim, dance, whatever, with sepsis survivors, advocates, etc. And they created a Sepsis Heroes website. Sepsis Alliance Connect, that's a virtual support for the community. It launched a year and a half ago, over 1,000 members already, as you can see. They have virtual peer-to-peer conversation, pre-recorded programs, etc. And then they also have, the second one is provider education. They've done a lot of CME courses, 150 free courses, major conferences, symposia, 275 subject matter experts, 40,000 clinically trained, etc. They got funding from the Biochemical Advanced Research Unit. So provider education is very important, and I think those are the 2 major pillars we need to. Advocacy, they're working with a slew of different organizations in the US, and we've spoken about advocacy, Sepsis Awareness Month, September in 40 states, etc. And innovation, they're working with BARDA and CBC and a few other organizations, branches of the NIH, and they are doing a lot of work there. The bottom line is, what they have done is really heightened to the CDC that US hospital programs are deficient. Only 73% has a sepsis committee, 55% has dedicated sepsis program leaders, and 55% a antimicrobial stewardship program. So half only has leaders, etc. This comes from the CDC. And what did the CDC do? Follow it up with this. The sepsis program, the elements that they'll be tracking and making sure you have leadership commitment, accountability, multi-professional expertise, action, tracking, reporting, and education. And people will be judged against that. And that's the sort of the core elements of an action plan. And in fact, today, Sepsis Alliance is launching their campaign for an action plan in the United States. Finally, what do we have? We have Sepsis Canada that has been doing a yeoman job with very minimal resources. $5.7 million is nothing when it comes to investment on sepsis, which is the number 1 killer. And we can see we ran over budget and those things, and Alison and the group has been, Assad and the group have been doing a very good job. But we are creating cynics out of our researchers when we have to go back and cut back on the funding. And I think that is a shame in a country like this. So that's what we have so far. We have the Canadian Sepsis Foundation, but look at the mission statement and the vision. I mean, the mission statement is to develop a strategic plan, sort of develop patient stories, advocating, et cetera, et cetera. I think the mission statement and the vision has to be simple. It rolls off your tongue like the US, right? Same as cancer. We will cure cancer. Everybody knows that, okay? But we have not done a good job with the Sepsis Foundation, and I think we have a good yardstick across the way that we'll need to follow. And I'll stop there. Thank you very much. And as the old African saying,
thank you very much for all of your work, your support within the network, and maybe an appeal for you and I as the president and vice president of the Canadian Sepsis Foundation. We need patient partners and others who are interested to help step up. Tex and I can't do it all. Christine, who's been running the patient story page for 10 years, can't do it all. So here's an appeal from us to come help step up and run the board.
Yeah.
You can see my passion related to sepsis, but was it going to be the research passion, the advocacy passion, doing both at the same time?
Yeah, no, I agree with you. I think we need individuals, and we'll be willing to step over to provide support. In fact, with cancer, the way they got around it, they said for any disease, it's like a religion. You need a prophet, a prophecy, a book, and a revelation. And for cancer, the prophet was Mary Lasker, who was the CEO of cancer. The prophecy was we will cure cancer. The book was Alexander Solzhenitsyn, Cancer War, the miserable thing. And the revelation was in '69, when men went to the moon, they said, we've conquered the heavens. There's nothing here. And there were 450 articles on cancer in New York Times, and every president since, right, has stood before the podium, and you can go look it up, and say, we will cure cancer, there's money for cancer, there's money, and that's where we have to get to.
Tex, thank you. I have a few other thank yous to give.